Good morning, everyone. I'm a little bit late this morning for our little chat on and today we're going to talk about reflux, actually, or reflux, or it can be GORD or GERD, depending where you live. So gastroesophageal reflux disease for their technical title. I hope everybody had a great weekend. It's beautiful weather here in Sydney at the minute. So beautiful. Sun is shining, warm enough that you can walk outside with thongs on, so that's really great. So let's get on to the reflux. The symptoms are generally you get a burning in your throat or your esophagus. There's a couple of other distinguishing features. You might have a cough that comes out of nowhere and you haven't had a cold, you just get this cough, or you get a constant cough all the time. Chest pain, a hoarse throat. Difficulty swallowing is a really big one with this. Watery mouth, so your mouth just feels like it's filling up with saliva all the time. I'd go to the doctor and get that one checked out if that's happening to you. Constipation or constant burping. So I have seen people get quite bad sinus problems. I've seen people with lung problems that have had bad reflux and even silent reflux that they didn't know that they were getting. So some red flags when you need to go to the doctor to get it checked out are things like constant anemia and you can't find the cause, bleeding in your bowels, or blood in your phlegm. If you spit and there's blood in it, they're dead set signs you need to go to the doctor. A melena stool. So a melena stool is where the stool comes out black. And that just means you're bleeding somewhere higher up in the digestive tract. It's a little bit frightening when it happens, but that's a sign you should go to your doctor. You need to find out where that leak's coming from, and it's a good thing to do that sooner rather than later. So doctors will normally put you on a PPI if you go to them complaining about reflux, or a H2 antagonist. And they should be you should only be really on those for about 6 to 8 weeks. But as all of us know, doctors keep people on these for years and years and years. So you can also take over-the-counter medications like Mylanta, if you're in America, Tums, Quickies, Gaviscon, all those sorts of things. But they are short-term solutions as well. So something I find with clients that are really good with the over-the-counter ones is if you take them before a meal rather than after the meal, which is prescribed, it actually coats the whole esophageal area and you're less likely to get that blowback of acid when it happens. And that's a short-term solution. It's not a fix, but it just helps you get more relief than having to chew those things for over and over. Because some of them have high iron, some of them have aluminium in them, and you don't want to be taking those long-term. If you're trying to wean yourself off your PPIs, get your doctor's support with that. And if you're going to use herbal medicines or nutrients, you have to dose twice as often, or even more, to get the same coverage as the pharmaceuticals. So the proton pump inhibitors can last around 15 to 21 hours and are effective at controlling the amount of acid. If you swap over to herbals, you need to dose at least 5 times during that same period of time to get a similar effect, depending on your unique circumstances. So there are lots of side effects of taking proton pump inhibitors long-term: osteoporosis and stomach cancer, to name a few. In fact, last week, maybe it's about 2 or 3 weeks ago now, Zantac has been pulled from the shelves because it has been shown to be increasing the cancer risk. So if you have been on them for a long time and you want to try and get off them, seek help with that. Proton pump inhibitors also leach calcium from our bones, and this will upset our entire mineral balance, which can be problematic. And with over-the-counter products, for example, Mylanta, they increase our risk of osteoporosis as well. So taking those things forever are not a good thing. Diarrhea can also be a side effect because it builds up the magnesium concentration in the kidneys. So short-term use for those only. Take them as a temporary measure when you need them. And I talked about the proton pump inhibitors depleting our minerals. So it's not just calcium, it's magnesium, it's iron, and a lot of those other ones that are really important in bone building and stuff. So we know that they increase our risk of fracture. So what are some things that you can do? Thanks, Irene. So some things you can do if you're overweight, lose some weight. As the intra-abdominal pressure pushing down on your diaphragm opens your lower esophageal sphincter, and then the acid rises back up. So one is if you're overweight, lose weight. Two, if you're a smoker, stop. They don't know the mechanism behind why smoking causes people reflux. They just know that mostly smokers get it. Get checked for Helicobacter pylori. It's a problematic area around this, and some people just have a genetic predisposition to get reflux, which is not great. So I'm always really surprised by this one, that women get reflux more than men, because I see it the other way around in clinic. So that's a really surprising statistic for me. So if you're 50 plus, you've got more chance of having reflux, and if you're pregnant, you also have reflux. And I can say from personal experience with 3 babies, with all 3 of them, I had such severe reflux I had to sleep sitting up, but the moment the baby was born, the reflux completely went away. So because it's squashing down your organs and your digestive organs and your diaphragm, which is opening that lower esophageal sphincter, blowing everything back up. The reason over 50, and I think I say this a bit further down too, as we age, we lose hydrochloric acid. So, and the longer the food sits in our stomach, the more the pressure builds up, and 2, it just opens that sphincter higher. More, not really higher, but more. So if you don't exercise, you should start, because that's really helpful for reflux. And with our diet, you need to remove fast foods. I often see in clinic people who are on high carb, high carb diets with low fat. I often see those people suffer reflux, because it tends to starve their gut bacteria, and something tips the scale for them, and that gives them acid. Psychological stress, and this one is so underappreciated by most people. When we have psychological stress, and most of us are under stress every day, environmental stress and other stresses, it increases that amount of acid that is produced. So that's something to think about. So every day you need to be putting some stress relieving action into your day. It could be as simple as going for a walk, meditating, even just sitting in silence for 10 minutes, trying to relieve some of that psychological stress. Because I used to have a lecturer that used to say the issues are in the tissues. So everything goes into the tissues and stored there. So think about that. Check for food intolerance is another one. I see people with orange juice, chocolate, all those sorts of things that can exacerbate reflux, but it can also, sometimes those foods can be the instigator of reflux. So check those out, and sometimes you have to eliminate foods to be able to do that. It's not like there's an instant thing where you can test that that's going to be the food that gets rid of your heartburn. And again, as we age, it's really difficult to break down proteins because of the loss of HCl, and as you age, you'll lose your appetite for that reason too, because you no longer have that digestive fire, and once you don't have that, you have more chance of the food sitting, which will then increase fermentation, will increase bacteria load in the area, and then it will cause that pressure of the lower esophageal sphincter to open and cause the acid to rise up. So you want to avoid that if you can. Don't eat large meals. You can eat smaller meals more often if you suffer reflux. But I am under the impression for reflux, a lot of people, if they had 3 meals that were really quite well balanced, that would relieve some of their reflux. Don't eat 2 hours before bed. I find that if you eat and lay down, that's problematic because the acid rises straight away. And to remember that our greatest acid production is between 11 p.m. and 2 a.m. So if you're laying down on a full stomach, it's going to happen. So try not to do that. If you have a motility issue, so you've got constipation or diarrhea, look at small intestinal bacterial overgrowth and see if you fit those symptoms, because that sometimes can be... There can be a chicken and egg scenario. You could have SIBO because of the reflux, but reflux is getting worse because of the SIBO. So then you have to resolve the SIBO. So look at the information around that and see that if that's not you. So turmeric in capsules can be really helpful to lower the inflammation. It won't take away the reflux, but it will help lower the inflammation. And part of the pain around reflux is the inflammation. It's like that raw surface that's getting acids dropped on it over and over and over again, and it just causes a level of inflammation forever. So you need to reduce that inflammation and then heal up that tissue. Fenugreek tea is really excellent because it helps lower inflammation. It just has a unique smell, fenugreek tea. So if you can get over that, it's really a good tea for lowering inflammation. So there are many herbs and nutrients that will help with reflux to repair the damage. And to make sure that your hydrochloric acid is working properly and that your digestive fire is really strong. They're the three things that I think are pretty important when it comes to reflux. And things like not wearing clothes that are overly tight, because again, you're increasing your intra-abdominal pressure, and that can be problematic. And doing things like raising the head of your bed so it's a little bit raised rather than laying flat will also help. So the consequence of long-term reflux, it can turn into Barrett's esophagitis, which is where you get scarring and constriction in the esophagus. And Barrett's often precedes cancer. It doesn't cause cancer, but it often precedes cancer. So it's good to keep getting it checked and updated to make sure it's not moving forward. And about 5% of the people that get Barrett's go on to get cancer. So if you get Barrett's, it doesn't mean you're automatically going to get cancer. It just means you need to be really on top of what's happening with you. So that's my top things for reflux disease, or GORD or GERD, whatever you want to call it. And next week I will come on and talk about something else otherly exciting as that. I haven't figured that out yet. Digestion Basics, my course finishes up today, so that will be good. It's been a huge week, and so the membership doors will be opening tomorrow for that. And so all should be back to normal by next week, hopefully. So have a great week, everybody. Any topics you'd like to see, just leave me a question below, or if there's any comments you'd love to make or questions you'd like to ask, just leave me a message below and I'll get back to you soon. Have a great week. I look forward to talking to you soon. Bye.